Thank you to ARCAP for the wonderful invitation to be able to speak with you all today. What I'm going to be presenting on is telehealth delivery of our mental health support service at the Children's Hospital at Westmead for young people on the autism spectrum and their families. To tell you a little bit about our team, we're called the Developmental Psychiatry Team, and we're a multidisciplinary team with allied health professionals, including psychologists, neuropsychologists, occupational therapists, and social workers, as well as a medical team of psychiatrists and pediatricians. And we deliver outpatient supports when patients who have a diagnosis of autism spectrum disorder or an intellectual disability who also have a mental health condition like anxiety or depression, their pediatrician will refer to our team, and we then provide assessment and mental health support. We have transitioned over to most of our appointments being via telehealth. So since March of this year, we've developed telehealth services to 160 individual patients. But actually, we have a 20-year history of being able to deliver rural and regional patients telemedicine mental health service. So it's been wonderful to be able to build on our history of doing that. We've newly launched what is called the Mental Health and Intellectual Disability Hub, and that is a purely telehealth service where we provide second opinion support to clinicians in the community, as well as one-off consultations for patients who have complex mental health needs, who also have a diagnosis of an intellectual disability or developmental disability like autism. And finally, telehealth programs are delivered via the Westmead Feelings program. So that's a manualized intervention which looks at preventing the onset of mental health concerns by teaching children on the autism spectrum social emotional learning skills. So that's a summary of the telehealth programs we've delivered. And to talk a little bit about why telehealth mental health treatment is so important, what we know from an Australian survey of all Australians on the impact of COVID-19 on their mental health is almost 50% of them reported feeling nervous in the 4 weeks prior to that survey being conducted. But even pre-COVID, what we know about the mental health needs of people on the spectrum is up to 70% experience a mental health problem like anxiety or depression. So we can only imagine that the rates of mental health problems are even greater for people on the spectrum now. In terms of the research, looking at what impact COVID-19 has on the mental health of people on the spectrum, I'm very pleased to do a bit of cross-promotion for my colleagues at ARCAP that they're participating in an international study. So if you're a parent of a person on the autism spectrum, I would love to have a look at the research results when we see what impact COVID-19 actually has had on the mental health and coping of people on the spectrum. What we know at the Children's Hospital is COVID-19 has led to a 50% increase in the mental health presentations of young people to our emergency department. So that is of huge concern for us. So in terms of evaluating our telehealth service, we have 2 research projects which have commenced. So the first is looking at our service for young people with intellectual and developmental disabilities, and we'll be interviewing and sending surveys to children who have received services through us, their parents. We're interested in clinicians' views as well. And we're also interested in the people who refer patients to our service and whether our telehealth services are meeting the needs that they see for their patients and being able to support mental health adequately. And the second project is looking at telehealth delivery of the Westmead Feelings program. And so what we want to be doing is coming up with a set of recommendations that are evidence-based as to how to best deliver the program via telehealth modality. So what are some of the challenges of mental health treatments? Well, some of the results that I can show you don't come from our patients with mental health conditions or who are on the spectrum, but an interesting comparison is that of a hospital-wide survey where 10 departments are looking at their telehealth service. And 242 people have so far come back. And what I think is quite interesting is when asked how comfortable they feel with a telehealth appointment delivered around counselling or mental health, only 28% say that they would feel comfortable. My question is whether they're reporting on their comfort with mental health intervention and perhaps some of the stigma attached with mental health problems, or whether that's actually around telehealth. So I think it's really important for us to be conducting research so we have a firm evidence base that then directs what we do with our future services. Some of the other research some of the other data that's come from this hospital-wide research is one of the biggest challenges is not being physically present with the patients that the professional might be seeing. And in terms of mental health and our work with people on the autism spectrum, what our team recognises is that engagement and rapport is much more challenging. And so we're really working hard to develop our active listening skills and to be able to utilise these more over the camera, because I think we can very often just sit back and not be dynamic, and that then impacts the engagement and rapport process. It's much more difficult to read the nonverbal communication of someone over the other side of the screen, and managing risks. So this might be risk of harm, safety concerns that we have for our patients with mental health conditions, that those are difficult to act on when you're in a separate physical location. And so always having the phone number of the physical location our patients are at and knowing what the physical address is should we need to call for help or send assistance over. And positive behaviour supports are much more challenging also to be able to support the mental health sessions we have. So devising session schedules or reward charts, being explicit about the rules, having to adapt the way in which we deliver our mental health treatment so that we can still utilise positive behaviour supports has been a challenge. Technical issues always arise when it comes to telehealth, and in our hospital-wide survey, over 60% said that there were no issues with the technology. However, it means that 30% did have issues. So for us at the hospital, identifying which platform is best to use to meet our patients' needs, but also privacy and security needs is really important. I've talked a little bit about modifying therapy materials in light of PBS, but I think also it's thinking about using worksheets and making sure that we can still interact with our patients when utilising these sorts of approaches to support their therapeutic process. Privacy is another challenge. So I know last week I was doing an initial assessment with a young person and had to ensure that I knew who was sitting in the room with them and actively ask and get them to scan the camera around the room, because previously I've had siblings and parents who have unknowingly been a part of our session unintentionally. We found that telehealth suits certain mental health conditions better than others. So, for example, we had to assess someone for psychosis who had a diagnosis of autism and a severe intellectual disability. And to be able to do the observation that was necessary over telehealth, as well as the complex interviewing with their parents and carers, wasn't possible. And so we brought them in for face-to-face appointments to allow for that observation to occur. And also that telehealth suits certain therapeutic modalities better. So parent-mediated modalities, so where we might be working with a parent to help them support their person on the autism spectrum, or structured therapies like cognitive behaviour therapy are much more suited to telehealth. And also the additional support for learning and attentional difficulties, that it is a challenge for those who need additional supports beyond what can be provided when you're interacting via a screen. But what are some of the benefits? And certainly our hospital-wide survey has shown that social distancing, convenience and time-saving benefits are those that are rated highly. We've found in our mental health service that we're having new families attend who we've never met before, because dad can zoom in from the office or grandma can zoom in from her house. People, not surprisingly, don't want to come to hospital unless it's for COVID, and so it's been of benefit for patients not to have to come into the hospital to see us for mental health support. We've also found there's greater professional collaboration, so the ability to be able to meet over telehealth. And home observations also, as I think Genevieve mentioned, has been wonderful. And many of our team have certainly found that technology has been a great tool that's added to their therapy kit, so to speak. So the use of a whiteboard function in some of the different telehealth platforms, as well as screen share, has been really helpful. And finally, one of the things that we're really interested in looking at is what is the family and patient experience in terms of how involved they feel in their mental health journey, how well we're able to explain the therapy process to them. Are we still able to give them the respect that's warranted in treating our patients, and what's their overall satisfaction level? So you can see here in the green and blue bars that overall these are still rated very highly for our patients across the hospital. For our patients on the autism spectrum, what we know is that individual preferences are central to whatever we do with care, however we deliver, whether it's face-to-face or via telehealth, and giving options of being able to come into the hospital if that's what is best for them, or via telehealth is something that we are focused on. So finally, what are we going to do in terms of changing and improving our practice? We know that telehealth is going to stay, and we're really pleased at the hospital at the government announcement that Medicare benefits for telehealth sessions are extended until the end of March of next year. What we know for our team is that research is going to inform any practice change that we make. And the key question for us is our mental health service that we're delivering via telehealth as good as what we deliver via face-to-face? And overall, what we're aiming to do is improve all of the mental health services we provide to people on the autism spectrum and their families. So I'd like to thank my professional collaborators for these slides, and of course all the patients and their families who have worked with us over these last months of telehealth. Happy to chat further, so please connect with me on LinkedIn. You can find me at Dr. Michelle Wong. Thank you very much.